All right. Hi, everyone. I hope you're doing great and you're having a wonderful day. So, welcome to today's session. And before we jump right into the session, let me introduce our platform, Positivity. So, Positivity is a Singapore headquartered mental health organization committed to making quality mental health care accessible and affordable for everyone. Our aim is to connect individuals with the right expertise and experts and on our platform while creating awareness as well. And speaking of awareness, we have a very interesting webinar topic today, which is understanding the addiction brain, why quitting is so hard, and what we can do to help. So now addiction is often misunderstood. Simply, it's basically simply a lack of willpower, but it's actually changes, how you are and your brain as well. So in today's session, we're going to explore that and how it can be difficult to quit. So we are joined today by Ms. Stuti Sood, a psychologist at Possibility, and she works with individuals expressing stress, anxiety, low mood, and life transitions. And she uses approaches like cognitive behavior therapy and client centered therapy. So we are really delighted to have her today, and she will be starting the session. So over to you.
Okay, thank you so much for the introduction, and I'm very excited to be here. So, today we're going to talk about, like you already discussed, about addictions. And in this webinar, I'll try to cover everything that you want to know about addictions, what are addictions, and myths about addictions, and so much more. So, now I'm going to share my screen so that everybody can see the content. Okay, is the screen visible? Is it okay? Yes. Okay, so just to introduce the topic once more, today's topic is understanding the addiction brain and why quitting is hard and what can help. So, the basic idea for this webinar is to understand about addiction and anything and everything that is related to addiction, like, relapse, quitting, brain chemistry, everything. So I know it can sound very complex, but I have designed this webinar in a way, my content in a way that, even if you don't know anything about addiction, you will not get any kind of confusions, or, you will not get lost in whatever is being discussed. So please try to be here with me, and thank you so much for listening to me today. And I can assure you that I will make everything as easy as possible. So no matter who you are, no matter from where you're attending this webinar from, so it's going to be a very smooth sail today. So let's dig in. Okay. So this is everything about the website Positivity, which I think is already covered. So I will just move ahead to what are the points of discussion today. So today we're going to discuss about what is addiction, how addiction changes the brain, why quitting is very, very hard. And I will also discuss some myths and facts about addiction, and what can really help in addiction, like practical strategies. And I think the most important thing when I'm talking about addiction is the role of the loved ones and the society and the people around. What can they do about it? So again, I'm just going to repeat myself that this is a webinar which is actually, I created everything in so much with so much comfort and ease to you that it's not going to feel heavy, and there are no heavy terms or neuropsychological terms involved here. I've tried to keep it as simple as I can. Okay, so let's start. Okay, so if I talk about addiction, so addiction does not always limit to what we think it is. Like, does not always limit to substance. It could be related to behavior as well, right? So when I'm talking about behavior, it can be anything that has a rewarding effect, right? So a person experiencing addiction repeatedly seeks a substance or a behavior because it has a rewarding effect, and that rewarding effect reinforces the urge to continue. So if I have to, really explain it into a very easy way, it would be that something becomes addictive when you know that, it's going to make you feel good, or there is a reward attached to it. And because of that reward or that good feeling, you want to repeat the behavior again and again, or the person wants to repeat the behavior again and again, right? But this could actually result in problems like personal problems, social problems, and even health related problems. So when I'm talking about addiction, I'm not just talking about the substances that, alcohol or any kind of other substance abuse that I'm talking about, but I'm also covering behavior. Like one of the things that is, very trending today is doom scrolling, or what do you call as social media scrolling. We spend endless time on social media, and kind of, it becomes very addictive. Every notification gives you that rush of just going and checking your phone, right? So behaviors can also be very addictive. So in short, addiction is anything that is giving you a rewarding response, and because of that rewarding response, you want to keep repeating that behavior, or you want to keep going back to that behavior or substance again and again, regardless of how it's affecting you. Right. So, like I already mentioned, that alcohol can take different forms, like addiction can take different forms, like dependence on alcohol, nicotine, opioids, cocaine, anything. And also behaviors like gambling, binge eating, social media scrolling, all these can be very, very addictive and are a part of addiction. So, the American Society of Medicine, ASAM, defines addiction as a chronic brain disorder. So, it is actually a problem, and it's not just about somebody's willpower, or it's not just about somebody's just doing it out of because of no reason at all. No, it's actually a very chronic brain disorder, and it is very problematic for your health as well. Right? So, addiction is not just simply about poor choices. It involves changes in brain, self control, behavior, decision making, everything. And that is why understanding about addiction is very, very important for us. Because there is so much that we don't know about addiction, and we kind of, we need proper guidance and awareness. Only then we can help people around us or anybody who's in need for help, right? Once we understand what is the core of addiction, what addiction exactly is, right? So I hope I've covered everything when it comes to just explaining, just discussing about the meaning of addiction. So I've tried to keep it as simple as I could, right? And this is everything that you need to know, a basic idea about what is addiction. Okay. Okay, so this is a very interesting picture over here on this side, if you see the addiction iceberg. So it kind of shows you what we see about addiction, and there is so much that is hidden, It's like an iceberg. Imagine an iceberg. You can only see the tip of the iceberg, but you can't see everything that is, beneath the water. So if I explain about addiction, it is kind of like that. We only see the tip. We only see alcoholism. We only see behavior or substance abuse. We only see there is um, problems, health problems, everything, but we don't see what's underneath. That is escapism, that is emotional problems, that is abuse, that is trauma, that is so much more that actually leads to addiction, right? Or that could be the reason for somebody being addicted to a particular substance or behavior. So understanding the context is way more important. We only see what is the tip of the iceberg, right? So understanding everything that we don't see makes it very clear for us, makes it very it helps us understand what people go through. Okay. So here, as you can see, that there is a cycle of addiction. So basically, it kind of explains how addiction works. So there is an internal or external trigger. It could maybe be trauma, some kind of traumatic experience, or some kind of pain, trauma, anything could be the reason, right? Or even as simple as escaping a certain feeling could be a trigger for you or for anybody who's going through addiction. That could lead to emotional or physical pain, which could actually create that craving, create that urge, and that would ultimately lead you to use the substance or the behavior to cope with that urge. It'll give you temporary relief, but with time, there will be tolerance and dependence on that substance because it is giving you temporary relief. So the everything is here, right? So because of this temporary relief, we want to repeat the cycle again and then again and again. And that is how addiction cycle kind of, you can see the addiction cycle happening in real life. So I think I love these two pictures because it explains everything about addiction, and it covers the basic idea of what we should know about addiction. Okay. So, yes. So, if I talk about the next topic, that is how addiction changes the brain, which is exactly what we want to discuss over here, is the process of how addiction changes the brain. Why there are changes in your brain chemistry, and why are addictions so hard to overcome? Everything we're gonna get an idea over this in this slide particularly. So what happens is, number one that you can see over here is the dopamine shortcut. So what happens is addictive habits flood the mind with dopamine. So if you don't know what dopamine is, it is a neurochemical. It is a chemical that is responsible for reward and motivation, right? So any kind of addictive substance, it shoots the dopamine. And what it does is it gives you that drive, that feel good drive, that motivation to do this again and again, right? So the brain registers this as an instant quick fix. So what is happening is, because of the addictive substance, it shoots your dopamine, you feel good, you feel motivated, and your brain registers it as, this is a quick fix for my problem. Maybe if I'm trying to escape a feeling and I use social media to escape that feeling. So why am I doing it again and again is because there is a dopamine release, there is a dopamine flood, and it's making me feel like, this feels good. I have to do this because it helps me feel good, feel relief, gives me comfort, right? So what happens is, with time, other activities, everyday activities that were enjoyable to you, or you used to do them a lot, becomes less and less enjoyable, like hobbies, like socializing with people, like maybe investing in your physical health. Everything that earlier used to make you feel good, kind of are being replaced by the addictive substance or the behavior. Okay, and this start to feel like you don't want to do these anymore because you have found a shortcut to feel better. You have that kind of shortcut in your hand that makes you feel, gives you that instant pleasure. So these activities become less and less and less. So, which actually becomes problematic for you, because then you're not doing what you're meant to do, like your hobbies, activities, exercise, socializing, right? Your focus is completely towards the addictive substance or the behavior. Eventually, what happens is, because of this overstimulation, the prefrontal cortex of your brain, the part of the brain that actually helps you make decisions, right? The decision making center of the brain, the rational brain, kind of begins to weaken, because the cravings and the urge is so high that we are not able to make decisions, or rather wise decisions, or rationalize anything. There is just the craving, that there is just the urge to maybe use the addictive substance or the behavior that we are leaning towards, right? This is how your brain learns a new habit, right? So the one thing to understand here is that there is a term called neuroplasticity. It's basically the brain's natural capacity, or the ability to change, adapt, or modify. So basically, your neural networks, they kind of change with continuous habits. So that is why we say the brain is adaptable. So it physically changes based on what we practice, right? So the good thing here is, if addiction can change your brain, we can also see that healing can also change your brain. Some adaptability, if we start towards our journey towards rebuilding, towards recovery, so it can actually make physical changes in your brain that can actually help you deal with addiction. So basically, this is called rewiring, right? Or in neuropsychology, it's called neuroplasticity. Okay. So it's based nothing but the brain's ability to change, modify, and adapt, right? So if I talk about the process here, it's very easy. I'll just summarize it again. There is a dopamine shoot when we use an addictive substance or behavior which makes you feel good, which makes you feel like, there is a quick fix for whatever you're trying to fix, or it gives you the joy or the escapism that you're looking for. Eventually your focus becomes very less and less towards activities that you earlier enjoyed, hobbies, exercising, socializing, anything, and the addictive substance or the addictive behavior is what becomes your focus point. Okay. And moreover, with time, it kind of impacts your prefrontal cortex, your decision making system, because then the cravings are higher and the rational impulse gets weaker and weaker. So this is how your brain chemistry kind of changes, your brain physically changes. But the good part here is, because the brain can change, because the brain has the capability to change and adapt, it can change during recovery as well, right? So it helps you in the healing process as well. The brain's ability to adapt and change, right? So I hope I've covered everything, and I hope there is no confusion here. So I think we should move on. Okay. So now the question here is, that I think everybody keeps on thinking is, why is quitting hard? Because it's very easy to tell somebody, oh, you should quit this. Or you should just, think about something else. Maybe, put your energy to a different use. You'll get out of this. There is, maybe you're just overdoing it because you want to and everything. People give so many excuses. People give so many reasons, that why is, it's so easy to move on, but it's not. Quitting an addiction is very, very hard. And why is something that we're going to discuss here. Okay. So, number one is intense craving and brain changes. Like in the previous slide, we saw that it actually physically changes your brain, and the cravings become so much that your rational part of the brain kind of weakens. So, when there are physical changes in your brain, when there are intense cravings, it becomes very difficult to, control that. There is just a constant urge to seek relief. There is just an automatic and constant urge to seek relief, and you just want to feel good, right? So, when there are actual physical changes in your brain, it becomes very difficult for a person to just quit anything, or just maybe, just move on from the addictive behavior or substance. Second is physical and emotional withdrawal. So here I'm talking about the withdrawal symptoms. I don't know how many of you know that if you abruptly stop any kind of substance abuse, or if you abruptly stop any kind of alcohol use or anything like that, it kind of has a physical impact on you. There are so many physical symptoms and emotional discomfort involved that it becomes very difficult for the person to actually just stop and move on, right? So because of the physical and emotional discomfort that the person faces, because understand, the cravings are so high, the urge is so much that it is very difficult to resist, number one. Number two, your physical aspects changes, because I don't know how many of you know, but there are certain physical symptoms involved with withdrawal, like nausea, like, these are just very basic symptoms that I'm talking about. Nausea, diet changes, weight changes, even sometimes it kind of impacts your, how should I say this, mood, irritability. There's so much involved in withdrawal symptoms that it's not easy for a person to just move on and quickly get off of an addictive behavior because of the physical and emotional discomfort. That becomes like a daily battle for the person. Constant environmental triggers. So sometimes what happens is, you want to quit, you really want to get out of it, but there are so many triggers around you. There's so much stimulation around you that kind of makes it very hard for you to quit, right? Maybe there are people, maybe there are places, maybe there are mood shifts and everything. So you keep coming back to that habit again and again and again. So it's very, very simple. I'll give you a very simple example for this. If there are people who are making you feel uncomfortable, right? So maybe what you do is, when you're around them, you kind of open your phone and you start scrolling, right? So eventually it kind of makes you, it turns converts into a habit that, whenever you're around those certain people, you're gonna need something to do. You don't want to indulge in any kind of conversation. You want something, and that something becomes your doom scrolling, right? I'm giving you a very simple example just for everybody to understand. There is so many bigger examples involved here. So the point here is that sometimes environment around you makes it very, very hard. People around you, places around you, your own routine, maybe there is something going on in your personal life, or that person's personal life, that is making it very, very difficult to quit. So it's not always a choice, but the impact of the environment also leads to addiction becoming hard to quit. Okay. Tolerance and dependence. So eventually, what's happening is when there are physical changes that we discussed about on your brain, eventually your brain and your body both are going to get changed. So it your body is going to adapt to the habit. It would require that substance or that behavior to function normally, right? So it kind of becomes a part of your routine. It becomes a part of your everyday life. And there is so much dependence on that particular substance or behavior that it is very hard for anybody to imagine their lives without it, right? So because the tolerance is, or the dependence is so high on that particular substance, quitting becomes harder, right? Okay, the last point here is loss of stress relief. So many people rely on the habit as the primary tool to cope with difficult emotions. Like I discussed a little while ago, that sometimes there are personal problems, or sometimes there is so much going on in life that the person wants to just escape to something that is giving you a quick pleasure, that is giving you a quick fix. It could be any substance, it could be any behavior. So when the stress builds up, the addiction also starts becoming more and more and more, and maybe that's why the dependence also increases, and because of that, quitting becomes hard. So overall, the idea here is that, it's not very easy to quit because there is so much going on behind what we see. Imagine that iceberg that we're talking about. We just only see the tip. We don't know what's going on underneath. So it's exactly like that. We can always assume that it is so easy to just maybe quit. It is so easy to maybe just, leave and move on and start again, but it's not easy for the person who's going through this, because there's so much that is going on behind the curtain, right? So I hope it is clear, and I hope we can move ahead, right? Okay, so now this is a very important point here, because there are so many myths that we have about addiction and the people have about addiction, that I feel like they are somebody should bring more awareness to that, and I will do my best to actually create awareness as much as I can today through this session. So let's start by taking one myth at a time, and let's see what is a myth and what's a fact. So as you can see, it's clearly written here, addiction is a lack of willpower. But that is an absolute myth. That's not true. The fact is, because addiction changes your brain chemistry involved in reward, stress, self-control, it makes it very, very hard for you to quit, right? So imagine there are actual changes that are happening in your brain, and we just say it is just because of willpower. That is not right, right? So it actually leads to real time changes in your brain, and it becomes very, very hard to quit, right? Okay, so next myth that we have is people can quit whenever they want. This is actually the one that I think is very, very common, where most of the times we believe that it's very easy to quit. It's just you don't want to quit it, you can quit. We always say like this, no? But the cravings, the withdrawal, the brain changes, everything, it makes it so hard for a person to actually recover from an addiction, and the person requires a lot of support from the loved ones, from the society, from professionals, that doing it alone is not easy. And I think doing it alone is not at all um, you know uh, pleasing, and it's not at all comfortable, and there's so much going on. there are so many cravings, there are so many physical and emotional changes that I feel like, it's not just solely relies on the person, it relies on the people around that person, the society, the professionals. Everybody has to come in and actually take a part in that person's recovery. You have to hit rock bottom to recover. So, okay, so when we talk about addiction recovery, we always say that, it doesn't happen for mild addictions. You have to be, you have to have a very severe addiction for you to recover, or for you to go and seek help, which is actually not true. Recovery and treatment can happen at any phase of addiction. Even if it's a mild addiction, you can go and seek help. Even if it's a severe addiction, you can go and seek help. You don't have to wait for things to get worse and worse day by day for actually going and taking help. So please don't think that, there is this criteria to treatment, there is a criteria to recovery, there is a criteria to speaking to a professional. That does not exist. So please remember, treatment can happen at any phase of addiction. Even if it's mild addiction, you can go in and talk to somebody, talk to a professional, right? Okay. Relapse means the treatment has failed. So, relapse can be a part of addiction recovery because it can happen. Relapse does not mean that the treatment has failed or the person has failed. No, it just means that there are some aspects of the treatment that need modification or adjustment according to the person. We just have to tweak a little bit to get the maximum results. Relapse does not mean the treatment has failed or the person has failed. It just means that we need to make certain changes to get better results. Only certain people become addicted. Again, that is not true. Addiction is not limited to or specific to anybody particular. It can happen to anyone. It can happen in any environment. It can happen because of a certain environment. It can happen because of trauma, grief, loss, emotional regulations, anything. And it can happen to anyone. There is no certain population that is more inclined towards addiction, or certain kind of people that are more inclined to addiction. That is not the case, right? Behavioral addictions aren't real addictions. Okay, so many people believe that, when I'm talking about addiction, or rather when anybody is talking about addiction, it is just substance abuse. It is just based on alcohol, opioids, cocaine, anything like that. But that's not true. Addiction also covers behaviors like I already discussed binge eating, like I already discussed social media scrolling, gambling. All these are addictive behaviors, right? So behavioral addiction are absolutely in every way real addictions, because they also have the same impact on your brain like substance addictions do, right? So they also create that pleasurable feeling. They also create that feeling of quick fix. They are also create that feeling of uh, you know, s- temporary relief, quick relief, everything like that. So it doesn't mean that when I'm talking about addictions, I'm specifically talking about substances, or rather, anybody is specifically talking about substance abuse. Behavior is also a part of addiction, can be a part of addictions. Okay, treatment doesn't work. So that is not true at all. Addictions can be treated with the right kind of professional support, right? With the right kind of treatment intervention, and with the right kind of supportive system. Everything needs to be in place for a person to actually go through treatment and recover. It is not just based on medicines. It is not just based on therapy. It requires a combination of everything: medicines, therapy, people, professionals. Everything has to come up. Everything has to become a part of that ecosystem of recovery. And with all these things in place, a person can recover very well from addictions. Recovery is impossible. No, that is absolutely, again, a very big myth. Recovery is not impossible. Like we talked about neuroplasticity, the brain's ability to change and adapt, right? So it means that the brain can change and adapt anytime we want it to be, right? So if you're talking about healing, brain can heal over time. And absolutely, recovery is very much possible in terms of addiction. This is absolutely a very big myth. So these are all the common myths that we have all around. I'm sure there might be more, but for now, I just wanted to cover every common myth that we always see, and there is so much. Uh, that is going on in a person's life. So we have to understand what is the difference between a myth and a fact. So I hope this provides you with a lot of information as the idea that I had here. Okay. So I hope the part of myth and facts is very, very clear and we can move ahead. Okay, so now I come to the very, very important part of this webinar. What can really help? What are the practical strategies that can actually help somebody who's going through addictions? Okay, so managing triggers, identifying if any particular person, place, emotion, situation, anything is causing a craving, you know. For example, like I discussed before, if you're trying to avoid certain people and that the presence of those people is creating a craving or the urge to escape, so that particular group of people is the trigger here. So basically, first step in any recovery is identifying the triggers. What is creating that craving and how can we understand and plan ahead, right? So once we know that, you know, this particular thing makes you urge, you know, or makes the craving go very intense or increases the cravings like anything, we can actually understand the plan of recovery, and actually it can help the person in recovery as well, because once we understand the core cause we can actually work on it very well. Second is build healthy coping skills. So basically, like we discussed in the previous slide of why quitting was so hard, sometimes people use addictive substances or behaviors as coping. You know, it is an unhealthy way of coping, of course, but with as a coping or as a way of managing stress, anxiety, boredom, emotional problems, grief, anything like that, right? So instead of relying on certain addictive substances or behaviors, we can actually give you actually create alternatives for that. Maybe journaling, maybe practicing some kind of hobbies, relaxation techniques, of course, with the help and guidance of a professional, we can understand how to actually manage and create better coping skills, create better and healthy coping skills. Third point here is that I think is the most important point is please seek professional support, because addiction requires professional help, professional therapy, professional guidance, and everything, medicines, right? So having a professional help, somebody who is professional, involving people who are professional in your journey, will actually help you, ease those cravings and help you throughout the withdrawal and recovery as well. So please, please, please consider medical treatment, consider psychotherapy, consider everything, consider having all kinds of professional resources, and please seek professional help, right? It would really, really, really help you. Okay. Identifying halt triggers. So recognize that craving spike whenever you're hungry, angry, lonely, or tired. These are the halt. Sometimes more or less cravings or urges can actually spike when you're feeling hungry, when you're feeling angry, when you're lonely, or when you're tired. Understand that, you know, is any of these uh, becoming a trigger for you? Are you actually urging more? Are you actually urging or craving more when you're hungry, when you're angry, when you're lonely, or when you're tired? So give a good attention and acknowledgement to your triggers. Establish a healthy routine. So having a healthy routine can also help. Having good support system, having good physical activity, having a balanced diet, having a good sleep, having good activities and habits that can actually help you create long-term sustainability, that can actually help you ease that instant quick fix, quick relief kind feeling that we get from addictions. So all these habits will actually help you in the long run. Practice patience and resilience. Recognizing that recovery is a gradual journey. Recovery can happen a little bit slower also. Recovery can happen gradually. It's not an instant fix. You don't recover in a day from addictions. It takes time. It takes professional involvement. It takes support from your loved ones. It takes a lot of willpower. It takes a lot of resilience from you, right? So understanding that it's not a sprint, it's a marathon, is very, very important, because there will be setbacks. There will be times when, you kind of face obstacles in this journey. So understanding that this is a long run helps you understand how do you want to be during this journey? What can you do to help yourself? What can others do to help you? How can you adapt and move forward? Right? So these are all the things that actually I think these are very practical strategies that can help somebody. The most important, I think, here being professional support, because sometimes that can lead to a very, very, very big change in a person's life. Okay, so lastly, we talk about how loved ones and society help. So, if we're talking about somebody who's going through addictions, it is not easy to manage anything and everything alone, right? They require a proper support system, they require proper guidance, they require proper care, and most importantly, they require support from the people around, from their own relationships, from the society. Proper support is something that can actually help them heal better and heal comparatively faster, right? So, what you can do as to help somebody who is in need of help is something that we're going to discuss in this slide. This is almost the last, this is actually the very last portion of the webinar. So please listen to it very, very carefully. You don't know when, if you can change anybody's life, that would be so great, I think. Right? So let's see how loved ones and society can intervene and can help you, right? So number one is replace judgment with empathy. So I think this is the most important thing. Many times there are so many people that kind of see addictions through a lens of judgment. They don't understand that addiction is actually a severe medical problem. They think that addiction is all about willpower. If somebody wants to stop, they can stop. It's just maybe bad choices, but that is not it. We have to understand, and actually kind of understand with empathy rather, that addiction is actually a severe problem, and the person dealing with addictions can use empathy, can use support, because it is not easy to quit. It is not easy to manage the addictions. It is not easy to actually be in the recovery journey as well, right? So giving a lot of empathy helps the person. It makes them feel empowered, it makes them feel loved, and it gives them the fuel that they need on that recovery journey, right? Encourage professional help. Definitely, please, 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 if you have somebody that requires help, please always push professional help. Always actually ask the person to seek timely treatment, to seek treatment from psychologists, psychiatrists, de-addiction specialists, even medical practitioners if required in the during the journey. Everything, so that your loved ones or anybody who's in need can actually recover better. Having professionals in this journey is so, so important, because it's not easy doing everything alone, and having a professional guidance is very, very important. Offer consistent support. So I think the basic thing you can do is offer support. Be patient, listen to them, encourage them, support them, motivate them, right? Because the recovery process is slow, and there would be so many obstacles in the journey that it kind of gets very difficult for the person to be on this marathon. So giving them constant encouragement, motivation, becoming that listening ear actually helps them keep moving forward, right? Setting healthy boundaries. So when you're supporting somebody, avoiding behaviors that unintentionally encourage the addiction are very, very important. Sometimes the person is not intentionally involved in doing something that leads to addictions, or maybe the people around him unintentionally can trigger certain behaviors or can trigger certain things that can actually make the person crave addictions again, crave the addictive substance or the addictive behavior. So it's very important, if you're supporting somebody in this journey, please avoid behaviors that can actually unintentionally trigger their cravings towards a certain addictive substance. Create a supportive environment. So this kind of means that help them create healthy routines, help them invest their time in meaningful activities, and actually reducing their exposure to triggering substances, or the triggering triggers that we discussed in the previous slide, can actually help them on this journey. So maybe your encouragement, maybe your constant support and cheerleading is something that person requires. So encourage them to follow a good routine, to follow a balanced life, to follow their hobbies, activities, whatever they like, right? So sometimes a little bit of boost can take you a very long way. Reduce stigma. So I think this is very, very important, is that there is so much stigma around addictions, around mental health, around physical health when it comes to addictions, right? So we have to reduce that stigma. We have to educate ourselves as well as other people. Like, through the session, I'm trying to do that for as much audience as I can. So why are these sessions important? Because what is happening here is we're kind of creating that awareness. We're passing on that education to everybody so that we can reduce that stigma. So this is, I think, very important. Creating a safe space for a person to heal, creating a safe space for a person to actually come out of their addictions is very, very important. Okay. And the last point of this webinar is believe in recovery. Recovery is possible. Having hopes, having support, having encouragement is one of the very big factors in recovery. Believing in that you can actually get better is what creates that motivation and willpower within the person, right? So along with the person, please believe in this journey as well. You being the loved ones, you being the society, can actually add a lot of encouragement to the person's life. I think I've covered everything that we discussed in the first slide, and I hope I try to educate you a little bit. And I hope whatever awareness that you can get from this, you will pass on to all the people around you. Thank you so much for taking your time out and listening to me. And if there are any questions, you can just maybe ask right now or leave comments or anything like that, and we will definitely get back to you.
Right. So everyone, chat is open. You can drop in your thoughts, any reflection, any questions from the webinar, anything you like. And that brings us to the end of today's session. So thank you so much, Ms. Tuti, for sharing your valuable insights and helping us, understand what goes behind addiction, right? And why quitting is often so challenging, and how empathy and informed support can really make a huge difference in recovery as well, right?
Thank you
And
so much. Yeah, is it okay if I take like last 2 minutes?
sure, sure.
Yeah, I just wanted to share the positivity website and my profile for anybody who wants to reach out, so that it becomes very easy for the people to understand how they can reach out. Okay. So
Yeah.
this is the website. I hope everybody can see it, right? So this is the positivity website, and this is my profile. I have opened everything. So here you can see my name, degree, and what are the charges, session costs. Here you have options to select session duration, to actually check for available slots. Here are my credentials, the therapies that I offer, who I am, because knowing a therapist is very, very important. My area of expertise, my segment that I usually work with, concerns and everything. And here you can leave your reviews. So this is everything that you need to know. Here are the packages which are coming very, very soon, right? And through this, you can book your sessions with absolute ease. And I hope I see some of you in and I hope I see somebody in my sessions. And if anybody wants to reach out for help, you can always through our website. Thank you.
Right. So I've dropped the website link on the chat. Everyone can see. And thank you again for joining. And I hope to see all of you in our future sessions as well and future webinars as well. And have a great day, everyone. Bye bye.